I want to turn it over to Travis Vance. Travis is a partner at Fisher Phillips in their Charlotte office in the firm's Workplace Safety and Catastrophe Management Practice Group. I think many of you know and have worked with Andrea Ryan on labor issues. Travis is a colleague of Andrea. So Travis, we'll turn it over to you.
Okay, well, thank you very much. I appreciate everybody tuning in this afternoon on a very important issue. But what was mentioned in the opening there, the introduction was very beneficial, and he hit on the highlights that everybody needs to remember is that the biggest issue that we're having is a panic reaction to what basically comes down to a common cold that's just a very unique strand. And so for everybody on the call, just to understand a little bit as a background, is that a coronavirus is a very simple, basically common cold that can appear in a variety of different ways. But this particular coronavirus spreads quickly and has a high fatality rate for a common cold. It's about 2.3%. And that's why everybody appears to be upset. But the actual illness, the disease that we're talking about is called COVID-19, and that's the disease that you obtain from contracting this particular virus. So just a little bit of background for you guys. Obviously, it's spread around the world. The U.S. is not widespread at this point, although there's concentrated areas in Washington State of the outbreak, largely relating to one particular medical facility. It's not widespread the rest of the country, and as the gentleman noted, it's not. It's domestic travel is still considered to be safe, as well as travel in a lot of foreign countries. And in fact, the CDC has updated its website to note that there's only a risk of community spread of coronavirus in apparently approximately 8 different countries, which includes China, Hong Kong, Iran, Italy, Japan, Singapore, South Korea, Taiwan, and Thailand. So that largely excludes Europe with the exception of Italy, and certainly within the United States, travel is still safe. So just a few, I just want to go through briefly some of the legal issues and our best practices for you guys as employers and as workplaces and places. And then obviously I would be glad to take any questions that you may have. So the most important thing for you to do as far as your workplace goes is to make sure you educate all of your employees about the coronavirus and how it can be contracted, and remind them that it's essentially the common cold. And for most healthy individuals, they would probably not even know that they had it or assume that they had a small case of the flu. It really becomes an issue in living facilities and nursing homes. So my recommendation is to send out communication to all employees from a single source so that you have a single and consistent message about what the coronavirus is, how it can be contracted, and the precautions that your employees can take with respect to hopefully not contracting it. It's also a good time for your employees to remind your employees about policies such as ability to work at home, vacation pay, sick pay, FMLA, and short-term disability. Because if you have a situation where an employee will be missing time because of an illness, you may have to dig into those resources in order to figure out how they will be paid if they're missing time. Make sure you train your supervisors on not overreacting to situations. Let's say there is a confirmed case in your workplace, or someone has symptoms of an illness in your workplace, to not overreact, because at the end of the day, the reaction to COVID-19 will frankly be worse than the actual virus will be for almost all workplaces. Make sure you keep up with the CDC and World Health Organization websites. As I just noted from the CDC, it's a great resource for determining what areas are prohibited with respect to travel, where there may be an outbreak, and also for best practices in order to in attempts to not contract it. Just looking at some issues that you're going to see in your workplace with respect to employee travel. If you want to restrict business travel, even domestically, that is within your right to do so. And some companies have already restricted business travel within the United States, although we do not believe that is required or necessary at this point. With respect to employees who want to travel for a vacation or for personal reasons, You cannot restrict them or terminate them because they engaged in a lawful activity, because they have the right to privacy. However, you can encourage them to be educated before they travel anywhere, and in fact discourage them from traveling to foreign countries that are noted on the CDC website, or frankly anywhere overseas at this point. A lot of my clients are doing that. You can't prohibit it, but you certainly can encourage employees not to do it and educate them on what the risk might be. With respect to your business interruptions, make sure you work on a plan in place to have as many employees, especially your salary exempt employees, to work at home as much as possible. To the extent you work with contractors or have a supply chain, now's the time to talk to them about what precautions you're taking and educate your supply chain on steps that they can take. But because a lot of companies are dependent upon supply chains, and if their supply chain is not responding correctly and proactively to this situation, then that may impact your business. Attempt to schedule as many teleconferences as possible in lieu of travel. And just a couple of questions that come up for a lot of employers. Can you ask employees to stay at home if they have symptoms of the coronavirus or the flu? Yes, you can. You treat this virus just like you do the common cold or the flu. Employees are sick, they don't need to come to work. If they come to work and they show signs of an illness, you can ask them to go home. You can ask them to seek medical attention, and you can ask them to be tested for COVID-19. You can't require a medical examination. You can't give a medical examination at this point, but you can be very diligent and highly recommending that. A lot of employers will ask, can we take the temperature of employees? You cannot do that at this point. That's considered a medical examination. However, if the CDC or the World Health Organization declares a pandemic, then employers will have much more leeway with respect to that, and likely will be allowed to take the temperature of their employees. Now, put it in perspective, we've only had 2 pandemics since 1900, so that's a very rare situation. But the EEOC, the Equal Employment Opportunity Commission, has produced some very good frequently asked question lists about what employers can do in pandemic situations. I anticipate we probably will get a pandemic declaration, especially if it spreads further in the United States. Other questions that we receive are, can you ask an employee why he or she missed work? Yes, that is not related to any certain disability, so the ADA allows you to do that, to simply ask why they didn't miss work. You are allowed to do that basically at any time. We talked about medical examinations briefly. Those are generally not required unless an employee poses a direct threat because of a medical condition. At this point, absent a pandemic declaration, we do not see that the ADA would state that the coronavirus is a direct threat at this point, because it is essentially a common cold, and outside the nursing home, assisted living care context, it's not going to be a direct and immediate threat to most employees. The EEOC ask employers to take direction from the CDC, as I mentioned, with respect to, is there a pandemic that's been declared, and what countries are restricted travel with respect to outbreaks in those countries. Just a little bit about OSHA aspects that you may have in your facilities. OSHA does allow employees to refuse to work if they feel like there is a real danger of death or serious injury. However, at this point, even working in the public setting or around others who could be sick is not going to rise to that threshold. The only thing that could arise at this point, in my belief, would be requiring an employee to travel to China or to the other countries that are restricted by the CDC. Absent that, the employee is not going to have a right to just simply not refuse to show up at that point. Now, if you have employees that are in a retail setting, like the hotel industry, like you guys, that are cleaning up after others, that are using sanitizers, things along those lines with respect to cleaning agents, just make sure you have a very robust training program with respect to your hazard communication, the chemicals that they use, and that they have provided proper personal protective equipment such as gloves and goggles to the extent necessary. And under these circumstances, this is a good time to go back and do refresher trainings on those situations, because you're probably going to get some questions about those particular issues. One of the other things that we see come up very often is requests for issues relating to the wearing a mask, a surgical mask. If you've been to the airport lately, you've probably seen several different passengers wearing surgical masks. The U.S. Surgeon General, the CDC, and the World Health Organization all agree that if you're healthy, that a surgical mask is not going to help you. It does not act as a ventilator. It does not have a filter. And frankly, if you're putting the mask on your face after touching it, putting it on surfaces that may be contaminated, you're actually making your the likelihood of catching any sort of illness higher. So a mask is not going to help you. Masks are not going to be required in a workplace unless someone is working specifically in a medical field with an infected patient. Outside of that context, it would not be required under OSHA standards. However, for you guys as business owners, if someone asks if they want to wear a mask, it would be your decision from a business standpoint whether you want to allow that or not. Things that you would need to consider are what is the public perception? Is it going to cause a greater alarm? But frankly, even in the last week or so, I've actually seen a couple of TSA agents in two different airports wearing a surgical mask, which surprised me, because that would appear to alarm the public, and I was surprised that their supervisors allowed them to do that. But that's what we're seeing under the current circumstances. Just as sort of a takeaway list before I get into to the Q&A, which would be beneficial for you guys, more beneficial than just going through these issues. But just a few things to keep in mind. Make sure you train all your employees on the chemicals they use, and they're given the proper personal equipment, protective equipment that they need in the workplace. Remind your employees to wash their hands every time they contact a surface or an individual that could be contaminated. Make sure you educate your workforce. As I noted at the very beginning, that's the most important thing. What is the coronavirus? What is COVID-19? How can it be contracted? What can we do to prevent employees from getting that? If to the extent possible, ask your employees to work at home. Encourage employees not to come to work if they're sick. And just like my daughter at preschool, tell them not to come to work until their temperature is under 100.4 for at least 24 hours. Encourage employees not to touch their face, eyes, and mouth. The way you're going to get this virus is to touch a surface or touch someone else, and then touch your face. Encourage employees not to do that to the extent possible. If you have cleaning crews that work for a third party that clean your facility, I would accelerate those schedules, have more sanitation done, more cleaning done at this particular time. Make sure employees have access to proper hand washing tools and soap in the workforce, and that they're given the opportunity to wash their hands on a frequent basis. And then, of course, ask employees to contact a doctor if they develop symptoms of the coronavirus and be tested. You can't require them to do things of that nature, but you can highly encourage them to do that and reinforce ad nauseum that they are not to come back to work if they have any symptoms or if they test positive. Before I turn it over to the Q&A, just a couple things that have come up constantly. We are starting to get people that are testing positive in the workplace. So if you get a positive test, that person needs to stay at home for 14 days from the last exposure or whenever they were tested positive for that. Then what you have to do at that point is if there's somebody in the workplace that worked closely with the individual that tested positive or works nearby and has any concern about their interaction, then you need to poll those employees and say, how close did you work with this person? If you have people that work closely with that individual, those individuals need to go home for 14 days from the last contact as well. Hopefully they can work at home. But if we don't take those precautions, then we're going to run into a situation where it's going to be widespread within a given facility. So that would be my recommendation and what I have encouraged my clients to do. The last thing to consider with respect to sending people home is whether or not you pay them. With respect to non-exempt employees, hourly workers, you don't have to pay anyone that doesn't actually do work. However, you have to think about employee relations and public perception when it comes to paying individuals who are self-quarantined. You don't want to have a social media blast or issues that come up in the public arena because you're the company that required people at home and you're not paying them for it. Maybe they go get a job somewhere else, they infect someone else, they come into financial issues. So those are all things that you should consider. And I will tell you that most of my clients are paying the individuals that they send home for the self-quarantine because they have either been infected with the disease or have worked closely with someone who has been infected. So we've got a set of frequently asked questions that our firm has published. If anybody on the call doesn't have it, you can just let one of the moderators know. We can certainly get that to you. And I'm glad to answer any questions that folks may have on the call today. And I appreciate the opportunity to be on the call.
Thank you, Travis. That's very helpful information. I think at this time we'd like to turn it over to you all on the line. We've got quite a crowd, but I know that you're not a shy bunch. So Travis covered a lot of information. So if anyone needs clarification on anything he covered or any other questions that were not covered, now is the time. So if you could just identify your name and association, and we'll try to get your question answered. Any specific questions on labor law or protocols for employees or any other things that AHLA should try to track down as far as questions even beyond this specific area that we're discussing? That's one of the things I wanted to mention, is that we want to continue gathering questions from you all who are closer to the property level so that we can do our best to get those answered in future distributions to you or the next webinar or the next call. So any questions before Travis has to depart and we talk about messaging?
This is Amanda Toy from Michigan Restaurant Lodging Association. Good afternoon, and thank you for the information. You did give us a few things we could share with our members of what not to say to their internal staff, like forcing them to get tested for COVID-19, but you can say, I encourage you to. Are there any other things labor law-wise that you would suggest to us to make sure that either with our own internal staff or when we're sharing messaging with our members to be sure to avoid to say to staff?
Sure. A couple of things that come to mind are you can't take somebody's temperature. We have a lot of people out there trying to take people's temperatures or making so you can't require somebody to show you what their temperature is or physically take their temperature at this point. The second thing to keep in mind is that you shouldn't ask questions about immune deficiency issues or immune compromise issues, because those are all related to disabilities, and that would violate the Americans with Disability Act. And then the last thing that's coming up a lot with your particular industry is that make sure that your supervisors and employees are not discriminating against a group of individuals because of their national origin. So just because somebody travels from Japan or from the Far East and wants to stay at a hotel, that does not give you carte blanche opportunity to just tell them that they can't stay at your facility. And we've seen that come up quite a bit as well. So those would be three big issues that I would address as well.
Thank you.
Thank you.